Hi, everybody. I am Meg Boyko, Executive Director at the Teen Pregnancy and Prevention Partnership, and I am here with my friend Kirsten from the Contraceptive Choice Center in St. Louis. And I have a couple questions for you, Kirsten, because life has been a little different lately with many people under stay-at-home orders. And some of the young people in our community might need to visit a doctor for birth control or for a checkup. And I was just wondering, is it still a good idea? Is it important to get care right now?
Yeah, absolutely. It's still very important to get care right now. So right now at the Contraceptive Choice Center, we are still offering a range of care if you come into the clinic. So birth control counseling, birth control care. So if you need to switch methods, if you need to start up a method, we still absolutely have those services happening right now, as well as sexually transmitted infection or STI testing. We have that happening at our clinic. Or if you need to come in for an annual exam to see a provider, or if you've reached that age where you have to get your first pap smear done, something like that. We absolutely still have that care going on right now, available for you. That's what we have going on at the clinic right now. Yeah.
All right. So knowing that, how would I get a visit scheduled, or if I needed to refer a young person or a friend, how would I do that? And how would they get a visit scheduled right now?
Yeah, so really at our clinic, it's a pretty easy thing. If you're someone who refers patients, you don't even have to give like a formal referral, anything like that. If you're just a patient wanting to come in for care, if it's your first visit, if it's your 10th visit, whatever it is, all you need to do is give us a call in order to make an appointment. The number to reach us at is 314-747-0800. Option one is our awesome scheduler, Jasmine. She's super nice. She'll walk you through the whole process, any questions that you have about needing a visit, about payment for a visit, whatever that looks like, you can give us a call and we can walk you through all of those different things.
Awesome. And so can I schedule a visit online?
So unfortunately, we don't have like a online system that you can schedule through. But I always encourage people, we do have an email address. It's birthcontrol@wustl.edu. So that's birthcontrol@wustl.edu. So if you need to send an email through, just say kind of what you're looking for, what services, your name, your phone number, we could easily call you on our end. I know I'm someone who I don't always love making that first initial phone call. Being on the phone can be a little bit of a daunting task sometimes. So if you want to do that, we can always do that next step of giving you a call then, seeing what questions we might be able to answer over email for you, things like that.
All right. And so, with COVID-19 being in the community, what does a visit look like right now? And do I need to do anything to prepare to come in during this time?
Yeah, so a visit right now is definitely a little different looking than how it previously had been. One of the first kind of big things about making a visit right now is we do ask that patients wear a mask whenever they come in. It's really just for the protection of yourself, the other patients there, employees, things like that. Whenever you do come into the clinic, that can, again, be a little bit overwhelming when you first see it. We're in a building on WashU's campus, WashU's Med campus in the Central West End. It's called the Center for Outpatient Health. We are on the 7th floor of that building. That's where our clinic is. And when you first come in, you're going to be greeted by some folks who are going to ask some screening questions about COVID-19. So they'll ask if you've experienced any symptoms, such as fever, loss of taste or smell, kind of those different ones. They'll ask if you've had any interaction with someone who has been positive for COVID-19 or who you suspect might have been positive within the last 14 days. They'll likely also do a temperature check with you too. It's a real quick one where they just put it over your forehead. Pretty easy kind of going through there. So just something to kind of anticipate in preparation for the appointment. Say your appointment begins at 10 a.m. You might have a little bit of a delay getting in there while they just do that quick screening. Then You're going to go ahead and head up to the clinic space again, which is on the 7th floor. In the front desk there is going to very likely ask you those exact same questions too. Again, it's not to trip you up, it's not to worry you, but it's more so to just make sure you're safe and the other patients and employees are safe there too. Once you're in the waiting room, it's a pretty large waiting room. You might see some signs on some seats that say, you know, don't sit here because it might be too close to another chair, but otherwise very open waiting room for you to be able to be in order to wait for you to get called for your appointment. Then really kind of after that, once you get called for your appointment, it's pretty similar to how it's been in the past. You go back there, you get to talk to the nurse practitioner or the provider who's there that day. The only big difference is you're kind of both wearing face masks now, so that interaction is a little different looking. But yeah, overall, those are kind of the changes whenever you do come into the clinic. One additional thing to add to that too, those are the kind of in-person changes. If you're someone who is looking at starting a method of birth control, part of our kind of model at the Contraceptive Choice Center is we want to be able to provide you with that time to actually be able to talk to a contraceptive counselor about methods of birth control and what's available to you. Typically we do that in an appointment before you actually see the provider, but right now a little bit more for your safety, if we're able to, we'll give you a call before your appointment, maybe a day or two before, and we can actually do that contraceptive counseling with you over the phone. So you might be anticipating another phone call prior to your appointment, usually not super long. It's really kind of dependent on how much detail you want to go in with the contraceptive counselor during that time. But that's just something that's also a little bit more different than how we've previously, or how a visit previously looked. But overall, you know, you're still able to ask all of your questions when you come in person, when you talk to a provider, things like that.
That is very helpful because it may seem like now is not the time to get some of these things done. And it's good to hear that there's lots of ways to make sure your care still happens. So do you have any parting advice, words of wisdom, last minute things we need to know before people start calling you?
Yeah, so of course. So right now too, again, a lot of it's about your comfortability as well with coming into the clinic during this time. But just remembering too, you know, with birth control, if that's kind of the service that you're looking at today, there's a lot of really great benefits to continuing birth control or starting birth control, even during this time, whether it be contraceptive benefits if you're someone who's looking at preventing a pregnancy right now, or other helpful benefits, like if you are someone who has really heavy periods or really irregular periods, something like that. That's something that birth control can help you out with, even again during this time when I know there's it's a lot happening right now in order to kind of like look at that. So that's what I would say. You know, it's all based on your comfortability. And of course, if you have any questions, if you're someone who's looking for, you know, maybe trying to do a telehealth visit, if you're someone not super comfortable coming into the clinic, always, again, you can give us a call. You can talk to our scheduler. You can talk to someone else who might answer on the line too. It might be someone like me or one of our other contraceptive counselors. We can talk you through everything and we can walk through that too with you.
All right. Well, thank you for your time today. And I look forward to talking to you again, hopefully when things feel a little bit more normal. So thanks again, Kirsten.
Thank you.